Paul Lewis. I'm 60 years old. Back in the summer, I wasn't acting my age and I went across the street to play kickball with the neighbors. The next morning, I couldn't walk. I first started out, I said, well, I'll do the traditional medical thing, and I went to orthopedic, and he immediately pulled out the needle and the cortisone shots. It lasted a whole 2.5 weeks till I was back in pain. And it didn't go away and didn't go away, and then I found Magnolia Medical. And 10 weeks of therapy got some better. One knee was fine now, my right knee was not. Finished up the therapy sessions that we had planned and was still in pain. It's when we decided to do an MRI, and it showed torn cartilage in my right knee. And I was kind of at a loss, what do I do now? And then stem cells were mentioned. I have been a believer in alternative medicine for several years now, and I knew there had to be something to it. But yeah, you go in a little doubtful. You're hoping for the best, but you're not guaranteed, it's not that old traditional kind of medicine they do. But I did know that one thing for sure, I did not want to have surgery again. My right knee has had surgery twice. Within 2 years of the first surgery, I was having to have it again. Didn't want to experience that again, so I said, look, I'm looking for anything besides surgery. Didn't want to go back to the surgeon again. So I said, okay, let's try it. And I had the stem cell shot just prior to Christmas, and within a couple of weeks things were getting better. The pain was less and improving every day. Then 2.5 to 3 weeks in, was really getting better, except for coming downstairs. Stairs were still a problem. If you've ever had knee trouble, you know stairs are trouble. So I said, well, it's getting better. And then I would say a month in, that pain was gone too. And it's just gotten better since. Before the injection, anytime I stood up from my desk at work to go, and I work in a factory, so I would have to go to the floor, every step was pain. Standing up, I hobbled for the first 4 or 5 steps, and then it was just, okay, that still hurts. But now that's gone. I can get up and move around, take care of my job at work, take care of things at home. I live upstairs in our home, so having to climb the stairs several times a day is not a problem anymore. And coming down the stairs is not a problem anymore, which is a real biggie. So it's only gotten better since I took the shot, and right now I think it's pretty much on the miracle level. So one of the things that concerned me was the cost of having the stem cell injection. But in my history, with having surgery twice on my left knee, I was thinking back, okay, so if I have to wind up having surgery twice on my right knee, by the time I pay 2 co-pays for surgery, I'm out of work to go to therapy after the surgery, and all the pain in between, and having to mess with drugs you really don't want to have in your body, it equals the cost. It is an equalization of cost. You can do it twice. You can have all the pain. You can pay all the co-pays and go through all the therapy and the pain associated with that, or you can get the injection, and it's well worth the cost. I would tell them that it's not what you've heard all your life. It's not about you have to do the things the way that the surgeons say to do them. I would say stem cells are God's gift to do something different.